This article, Persistent Urinary Incontinence in Female Golden Retrievers Following Laser Ablation of Intramural Ectopic Ureters, may be associated with the presence of historical urinary tract infection, delves into the factors that can predict whether a female golden retriever will regain urinary continence after undergoing a laser surgery to correct a congenital urinary tract abnormality. This abnormality, known as ureteral ectopia, is a condition where one or both ureters, the tubes responsible for transporting urine from the kidneys to the bladder, open in an incorrect location. Ureteral ectopia is a common cause of urinary incontinence in young female dogs, especially in certain breeds like golden retrievers. The study specifically focuses on a type of ureteral ectopia called intramural ectopic ureters, CLA-EU, where the ureter opens within the wall of the bladder or urethra, but in a misplaced position. The preferred treatment for this condition is cystoscopic-guided laser ablation of CLA-EU, CLA-EU, a minimally invasive procedure where a laser is used to create a new opening for the ureter in the correct location within the bladder. While considered effective, CLA-EU has variable success rates, defined as the dog achieving urinary continence after the procedure. Previous studies haven't been able to pinpoint specific factors that might predict the success of CLA-EU. This study seeks to address this by identifying potential predictors of success in a specific breed of dog. The study retrospectively analyzed medical records from 41 female golden retrievers diagnosed with either unilateral or bilateral CLA-EU. All dogs in the study underwent CLA-EU performed by the same surgeon at the Queen's Veterinary School Hospital, University of Cambridge, between July 2016 and July 2022. The researchers meticulously collected data on clinical, ultrasonographic, and cystoscopic findings from the dog's initial presentation. Urinary continence was assessed using a 4-point grading system: grade 0, completely continent grade 1, occasional dripping of urine grade 2, intermittent dripping with occasional pooling grade 3, continuous dripping with frequent pooling follow-ups were conducted at 2 time points, 4 weeks, short-term, and more than 10 weeks, long-term, after the CLA-EU procedure. The primary objective was to identify factors that could predict short and long-term continence scores. The researchers hypothesized that the lack of a defined bladder neck and reduced bladder compliance would be associated with a lower chance of achieving continence after CLA-EU. Table 1 illustrates the number of dogs, with each incontinence grade at each time point. At the initial presentation, none of the dogs were completely continent, grade 0. Key results of the study: short-term continence, grade 0, was achieved in 46.3% of dogs without additional medical treatment. Long-term continence was achieved in 63.4% of dogs. A history of urinary tract infections, UTIs, before CLA-EU was negatively associated with both short and long-term continence. This suggests that dogs with a history of UTIs were less likely to become continent after the surgery. Ureteral dilation, as seen on ultrasound, was positively associated with the likelihood of short-term continence. Statistical analysis showed that while the final best-fit model for short-term continence wasn't statistically significant overall, the presence of historical UTIs had a significant negative impact on achieving continence. This was also true for long-term continence, where historical UTIs were the only factor significantly associated with a reduced chance of continence. The discussion section of the article emphasizes the following points. The study results demonstrate that while CLA-EU improves urinary continence in most golden retrievers with CLA-EU, a significant percentage do not achieve complete continence. The findings related to historical UTIs are particularly noteworthy. The study suggests that a history of UTIs may be a significant risk factor for persistent incontinence after CLA-EU. The initial hypothesis that a lack of a defined bladder neck or reduced bladder compliance would negatively impact the success of CLA-EU could not be confirmed by the study. The authors suggest that the small sample size and the subjective nature of assessing these factors might have contributed to this finding. The study also examined the relationship between ureteral dilation and continence, finding a positive association with short-term continence, but not long-term continence. The study acknowledges limitations, mainly stemming from its retrospective design and the small sample size. These limitations include the reliance on owner-reported continence scores, the lack of standardized long-term follow-up, and the subjective assessment of bladder, neck, and compliance. The authors recommend conducting further prospective studies with larger sample sizes to validate these findings and investigate other potential prognostic factors. In conclusion, this study offers valuable insights into the outcomes following CLA-EU in female golden retrievers. It highlights the importance of considering historical UTIs as a potential risk factor for persistent incontinence after surgery. While further research is needed, these findings can help veterinarians better counsel owners regarding the prognosis and potential outcomes of CLA-EU in their dogs. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.